Welcome to the Mental Health Minute for Women with your host, Ngozi. I am your mental, emotional, spiritual songbird. I speak to mental issues because I believe there is a great shortfall in understanding and the interest in this area. We should not exclude mental well-being from general health. In fact, the WHO, World Health Organization, defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease. That is why I think it is so important for us to understand the different types of mental disorders and for us to know the emotional difficulties that impact our mental health. Because each disorder and the unique situation of the person can call for different approaches to care. And one such approach is called psychotherapy. But what is psychotherapy? Psychotherapy occurs when the therapist communicates with a patient with the objective of helping that person find solutions to problems, relieve emotional distress, and modify their thinking. This is in order to facilitate a productive and enjoyable life. So, psychotherapy can help with less anxiety, greater self-confidence, better relationships, regaining emotional balance, increased assertiveness, stress relief, ability to set boundaries, and trauma resolution. Now, that's a lot. Take a moment to think about it now. This means that psychotherapy can be useful for anyone who has life. We could all do with some assertiveness, better relationships, and stress relief, especially now during the pandemic. But why do so many of us in the Caribbean hold a view that counseling is for crazy people? Any of us listen to this can become mentally sick, especially with a more common neurotic disorder, such as generalized anxiety disorder or post-traumatic stress disorder. Let me give you an example of someone who's acting in a neurotic manner versus someone who's carrying out a common behavior. This example is taken from webmd.com. Common behavior. You like to get to the airport 2 hours before every flight. That's common. A neurotic behavior would be you insist to get to the airport 4 hours before and you ask the gate attendant every 10 minutes if the departure is on time. Now you could see with this neurotic behavior, the person needs to learn something in order to reduce their emotional distress, and psychotherapy can assist with that. Cognitive behavioral therapy is one of the techniques that is used. Now, in this approach, people will learn how to identify and change destructive thought patterns that can have a negative influence on their emotions and their behaviors. So let's look at this example. Jane Doe has been trying to lose weight. She discovers though that she put on 0.5 kilogram. Now she could either have a dysfunctional response or functional response. Now if she sees herself as a failure, it's likely that she will not put much effort into her exercise and eating. But if she does not see it as a failure, she would likely continue exercising and eating well. So, what this means is that if we can learn to follow where our thoughts go and see how it influences our feelings and then our behaviors, then we can train ourselves to think in a more healthy manner that will improve our emotions and consequently our actions. This simple process can really improve our overall health. And like I said before, we can all add a little more tea to our mental health cup. So remember, we have a body, a mind, emotions, and a social life. Let us seek to strive for holistic health, and mental health plays a big part of that. If you are having difficulty coping, then please don't hesitate to reach out to a psychotherapist or counselor. Thanks for listening, and don't forget to subscribe, click the notification button, follow, share, like. Let us know what you think.